This is Local Edition. Brad Pomerance here in the San Gabriel Valley. We are joined today by Phillip Chen. He is a nominee for the California State Assembly, the 55th Assembly District. No doubt healthcare is still on the minds of so many voters. There's no question that California has been more aggressive with adopting Obamacare, the Affordable Care Act, but there's room for fixes, and you're looking at some.
Yes, we are. Right now, as you stated, California has a healthcare crisis. And part of that is because the state of California's Department of Health and Human Services has an $88.2 billion budget. LA County's Department of Health Services has a $4 billion budget. Department of Mental Health, 1.5, and Department of Public Health has $895 million in their budget. That amount of money can bleed over to other social areas. It can bleed to other California departments. And that's something that we have to look into.
Meaning it's bleeding in a way that's not of benefit? I'm trying to get a sense. Is it that the money's not accountable?
It's not so much the money's not accountable, but if the services are provided not efficiently or effectively, it can bleed over. For example, the overcrowding of emergency rooms in the state of California. Those are wait times, and every second in the emergency room is a life gained or a life lost.
So you're looking to create some efficiencies.
Correct.
Through consolidation and otherwise. It's a goal of the Affordable Care Act. Whatever one may think of the Affordable Care Act, I mean, it helps that at least the goals are the same.
Right. Well, there's three areas I think we should look at. And I think the first area is looking at ways to contract out with nonprofit organizations and also to private providers. In LA County, for a primary care provider, if you want to go for a sprained ankle, if you have a cold, it costs $197 for a directly operated clinic. For the exact same visit, it's $94 for a nonprofit or private provider to provide that service.
And how would that work? Can you still go to that nonprofit if you're covered through Cover California or another private insurer?
Yes, and that's the great thing.
Okay.
If you're covered by that, you can go through a private insurer. You can also go to that private provider or the nonprofit organization.
Okay.
The second area is consolidating those services.
Right.
Public health, mental health, health services, a one-stop shop. You go to one clinic, you get all your treatment provided for. And lastly, to be innovative with technology. Right now, something that's very popular and effective is telemedicine or telepsychiatry.
Let's talk about telemedicine, because I will admit I'm proud that our industry is trying to help move that technology forward, the cable industry, through telemedicine, and there are some successful efforts being made. You know, we forget here we are in the Los Angeles area, there are doctors everywhere, but if you're in North State California, it's not that way.
You're 100% right. If you look in LA County, North LA County.
Oh, even North, right, that's well stated. Right. Yeah, North LA County for sure.
Palmdale, Lancaster, Acapulco, Dulce. It's very difficult for them to recruit, retain qualified physicians, psychiatrists, mental health professionals, health professionals. So what they can do right now, and I've seen it done, is you have a psychiatrist in Catalina.
Right.
And you have them treating people in Palmdale, Lancaster. And the documentation has shown it to be effective and efficient. Patients love it.
So can this be done through the state legislature? Are you able to effectuate these ideas there, or is it a county issue?
It is a county and a state issue.
I see.
Proposition 63, Mental Health Service Act dollars. Those Mental Health Service Act dollars can be invested in telepsychiatry and in telemedicine.
Even with Senator Huff's move to adjust Prop 63 for mental health services to the homeless?
Yes, as it stands right now, there's over $1 billion of those services.
Plenty of money,
There's money, and it's how we divest and how we invest those resources that's going to be determined of what programs will or will not succeed.
So how's the race going?
The race is going fantastic. It's going very, very well.
Are you hearing about healthcare from your voters?
Yes, that's something that's of primary importance to them. The economy, healthcare, public safety, all those things.
Right. His name is Phillip Chen. He is a nominee for the California State Assembly in a district covering LA County, Orange County, San Bernardino County, special district. I'm Brad Pomerance, Local Edition.